Okay, are we ready to get started this afternoon? Welcome to virtual coffee, our coffee shop. Everybody by now knows me because Michael keeps making me do all this stuff. I am Sheila Barnett, Kansas NARO president. I would like to introduce all of you to Patricia Wells, who is the VP of National NARO. She is the executive director in Los Angeles, correct? No?
No, another great city in California, but I'm from the powerful place of Oakland, California.
Oakland. Okay, I apologize. My fault. I also want to introduce you to Sherry Swinson, who most of us in Kansas know. She is the director in Atchison, Kansas, and leader of the consortium up there. So Patricia's going to start us out. This is going to be kind of like a round table. If you have questions, put them in the chat. We're just going to discuss whatever comes to mind today. Patricia, it's all yours.
Thank you, Hattie, and thank you, Sheila. And it's so great to be with you. I see we're an intimate group this morning, which is really awesome. Because it was coffee, it's 11 o'clock my time, but I'm on number 3 here for the morning. And really grateful that despite the fact that the world changed for all of us, I still have a chance to see each of your faces and kind of be in your space. It's been an amazing 8 months, hasn't it? We've learned how to touch one another through a screen. And for me, in addition to my professional roles, I'm also the mom of 2 amazing people, both in grad school right now. But when they were young, I would not allow them to be on video games. And the TV was not allowed Sunday evening through Thursday evening. So it's kind of interesting to me that here we are, literally on an interactive TV screen connecting with one another. So it's funny how the world changes. And the world has changed. As Senior Vice President of NARO, I could have never imagined that my first year being able to serve our community of housers would be through a TV screen and would be virtually and would be at the same time that I took on the role of Executive Director for the Housing Authority in Oakland. And so I was appointed Executive Director on a Thursday and voted in and appointed as Senior Vice President of NARO that same Friday at our national conference. So that I thought was going to be my kind of baptism by fire, if you will, an initiation rite. And then on March 15th, the County of Alameda here in California went into self-quarantine. And our world changed, and I sent home all of the amazing people that I get to work with here in Oakland. And the Housing Authority here in Oakland, we're a large one. We have 374 employees, and we serve about 16,000 families amongst our various programs. I am an MTW agency, and I've been here with the Oakland Housing Authority for 22 years now. So I've grown up in housing and kind of grew up in NARO for the last 12 years, starting locally, as many of us do when we take on trying to serve more, and kind of went through chapter, then state, and then national service. So I've really been graced with an opportunity to give, and that's how I look at leadership. I was raised by a dad when for many of you who know, my mom came down with MS when I was 3. And so I was raised by my dad that no matter what our circumstances are, we're here to give back. And that's what I consider leadership to be, is giving back. And I think, like many of you that I'm looking at, and those that I just see your names, giving back has been what we've been doing for 10 months. And so that's been an interesting process, as it's not just about our residents, it's about our landlords, and ultimately about the staff that I get to work with, and just managing how to be a very thoughtful and considerate and mindful leader of the employees that I'm beholden to and the residents I'm beholden to. So we've spent a lot of time trying to help people with distance learning, which is a requirement here in California. making sure that they have the basic needs of meals and warmth and comfort and connectivity. So that's kind of how I'll start off the conversation. Is we don't necessarily want to just focus on COVID, but I think we kind of get it out the way to say that despite all of this, it's been about how to figure out new ways of connecting and giving back to the people that we get a chance to see and work with every day, whether it's on a TV screen, which is what I call this, or within kind of the same space, keeping 6 feet apart. So that's kind of Patricia right now.
Well, thank you, Patricia. You just made my life easy. I appreciate it. Okay, first of all, Kansas people, come on, turn your video on so we can see your smiling faces. We don't care if you're in your pajamas today. It's okay. Turn it on because it makes the coffee shop a little bit easier to talk to. If I see everybody and we're able to have a conversation. Mandy, you look absolutely wonderful, but I know that's not you sitting there perfectly still. Mandy Thomas. Come on. All right, guys. You're not going to play with me, even though I was going to give you a nice little prize at the end. The next time we meet in the hospitality room, I will buy everybody a drink.
Cool. So I don't have to buy you one then. We're even.
No, you still have to buy me one.
Can't get out of it.
COVID has been bad. There's a couple things that I want you guys to give me your feedback on. Starting with board meeting. What you been doing? How have you been meeting the Open Meetings Act as far as have you been meeting in person, keeping your social distancing? Have you been doing it video, electronic, whatever you want to call this TV screen? Or have you just not been meeting at all? What's carrying on out there? You may like to pipe in, because obviously with COVID, it has changed things.
It has not changed things for me, but our situation is so much different than everyone else. And I know that some of you have already heard me say this. Our county we are the next county from Colorado. So we are pretty much isolated from everybody, 3 hours from any town of any size. We have only had 19 cases of COVID in our entire county throughout the entire pandemic. So we've been very lucky. Everything here has pretty much stayed the same. Now, for a while, my staff and I closed our buildings. We made all of our deliveries ourselves. We protected our residents the best we could. When our city bus quit running, my staff and I made grocery store runs or picked up prescriptions to make sure that everybody was taken care of. We have masks. I bought masks for all of my staff and we wear them. Some of the tenants say, don't worry about it. I'm not worried about it. Some of them won't even open their door until they look through the peephole and see you with a mask. So it just depends. We had 1 month we didn't have a board meeting because our board chair was quarantined because she works at the bank and someone at the bank got exposed to everybody. Other than that, we've been meeting in our community room. We just sit a little farther apart and we've canceled all of our social events for our tenants and we're still doing our food deliveries. We're still getting them all the goodies that we can, but for the most part, things out here in the middle of nowhere haven't changed all that much. We're a little bit blessed.
Okay. Penny, type in. What are you doing with your board meetings?
Yeah, Penny, unmute yourself.
There it is.
Hi.
It took me that long to figure out the dang camera. I didn't want to miss out on the drinks. Well, I don't do board meetings. I don't have to go to the board meetings. I'm a cap agency, so our CEO goes to the board meetings. But they are doing them by Zoom. They're not meeting face to face. I'm still doing my briefings. We just social distance and mask. Other than that, everything's pretty much normal around here. So,
Wonderful, wonderful.
Sherry, Megan Reynolds is saying, first she's saying she doesn't have video or she would go for it. So she's showing us that amazing photo. So she's here visually. But they've been doing phone board meetings. Gets kind of complicated, which it absolutely can, for taking minutes, but they're making it work. And their annual meeting has been in person, but they even for that set up a camera with Zoom so folks could be able to watch the meeting. And we've done the same thing here in Oakland. We went to phone. We're doing phone meetings with Zoom, but what shows up on Zoom is the agenda and the presentations, not us as individuals and folk. And for public comment, we have an email box and a voicemail where folks can give public comment during the time of the meeting. So it starts at the beginning and cuts off at the end. And then I report back on public comment at the next meeting. So we've kind of done a combination, but we didn't, quite honestly, want to open up visual people Zoom meetings because we've seen with city council meetings here in Oakland, those get bombed, people jump in and say horrible things. And so we decided to just keep it to a phone meeting to kind of keep a little bit more structure to the meeting here in Oakland.
Yeah, you've got a very large population that you're trying to serve. So things get tricky for you guys. Absolutely.
Yeah.
We've been doing the Zoom. We obviously have other housing authorities besides just the one in Atchison. And we go from a very small agency of 15 all the way up to about 15, one's 32, another one's 60. And then over 200 public housing units. So with all of them, we've been doing Zoom, and then a few of them we've gone back to in person, 6 foot away with the mask. The biggest challenge, and I bring this up because if you are doing Zoom, the reason I mention that is for Kansas folks, we need to make sure we adhere to that Open Meetings Act. And how we got around that is our attorney, after talking to the state attorney general, is we actually put on our agenda our information as far as our Zoom meeting ID and for them to call for the password. And then that way we know who's coming in beforehand so that it doesn't get crazy. And then again, we control the muting, and they are only allowed during public comment. So I just wanted to bring that up because, they're notorious about hammering us after the fact. We didn't do something right, even though that we were doing the best we can to get the stuff done. So I wanted to bring that up. How about, has anybody been working on, of course, we got our CARES funds, but did anybody go out and try to apply for any additional funds, maybe through Spark or anything, Kansas people? Anybody jump on the bandwagon to try to get anything else, or you guys have all the money you need? Oh, sweet. I need to borrow some, so if you got extra,
Figuring out how to get HUD convinced to let us share, because I don't think I can give you any.
Dang it. Okay. How about, let's talk about inspections. What are we doing with inspections? Penny, I'm going to pick on you again. What are you doing out there?
we've continued doing inspections. Basically what we do is we call them the morning of, ask them all the pertinent questions. Do you have a fever? Have you been sick? Blah, blah. And then is it okay if we go ahead and complete the inspection today? So then he'll go ahead and go. Now, if he doesn't get an answer, or they say, no, I'm not feeling good, then we're going to reschedule it. We had to revamp our whole scheduling system so that we could still stay within the 12 months if we could. But other than that, it's been going real well and nobody's really turned us away. And then of course we do all the PPEs during the inspection with the masks and the hand wipes and the sanitizer and So we're still doing the inspections, have went ahead and done them all through.
We've kind of thrown it out there to each of our participants and residents to tell us what do they feel comfortable with. We can do electronic. That's been going very well. I actually have them do their own inspections while I watch, which has been pretty cool. And then, like I say, if they want us to do it in person, we'll do it in person. So it's been interesting. We intend to keep the video inspection as an alternative. That way we can give people choices. But I was just curious, is Manhattan still on there? What are you guys doing, Mandy? I think she stepped away.
Can I jump in and ask a question, Sherry?
You
Because first of all, I love the idea of kind of having the tenant do the camera and you kind of guide the inspection. That we're going to borrow that one from you. How has the staff been in terms of going into units and going through this experience, and what kind of things have we had to do to help them feel okay with going out into our units? What are you experiencing out there in Kansas? Anybody?
Well, actually, I will say our guys at first was scared, very, very scared. We did a total, cleaning, educating. They're more comfortable now. We used to have everybody get out of their apartment while our guys go in to do an emergency work order. Just having that social distancing and stuff. But it's been challenging. I think now that because we're into it 7 months, 8 months, however long it seems like 2 years, but they're getting more comfortable. Even with the numbers rising as far as being able to protect themselves. And I think that goes back to education.
Yeah.
We need to constantly educate. Anybody else? What are you doing? How do you guys feel? How's your maintenance feel?
Sherry, we have a comment in the chat from Megan who says, we are not doing inspections on the public housing side, but I am also pregnant, so being high risk and in a pretty COVID high county isn't quite conducive to going into units right now. Mark from Lindsborg says, we postponed filter and smoke detector inspections until June. We held comprehensive inspections in August, following all the proper protocol for safety and health.
Okay, wonderful.
My staff were more concerned about the possibility of sharing it with our tenants than catching it. So we go to someone's door with a mask on. If the tenant says, no, don't worry about it, the staff can take it off so they can breathe while they do the inspection. But there are a few that are high risk. And there's so many unknowns. You don't know if you've picked it up at Walmart and you feel fine, but you're still a carrier. So we're kind of leaving it at this point on the tenant side. Plus, we hired a young lady to do nothing but sanitize. She comes in first thing in the morning, sanitizes both buildings and the towers from top to bottom, anything that's going to be touched. And then she comes back in the afternoon and redoes it all again for the evening. So,
Are masks required there in Kansas?
They are
depends. It's kind of a city or a county ordinance, depending on where you're at. Out where we are, they are not.
Oh,
They are recommended, but not required. Now, I know last night at the high school for volleyball games, they were requiring masks in the gym. Last Friday when I was at a volleyball game, they didn't. So,
well, this is great. You probably read California, and specifically where I'm at in the San Francisco Bay Area, we hit the all-time high for the nation of cases and deaths on a couple of days. And so while we've plateaued high. And so we've been under the requirement for masks since March. And so we have to have masks and be 6 feet apart whenever we're engaging. So we've not gotten to games or anything. There's been a couple of outside activities, but we're under probably one of the more strict requirements here. So it probably looks and feels a little bit different when you come out our way.
Well, and I know even going from where I am to Hayes, Kansas, which is in the central part of the state, they have a mask ordinance that they just extended until, I want to say, October 3rd. So anywhere you go. Now, when I was there a couple weeks ago, I was in a couple of small shops downtown that the shop owner said, "You're the only person here. You don't have to wear your mask. We're not worried. But if someone else comes in, please put it back on." You know, as a business owner, I guess that's their right.
Yeah.
Let's see. Mark says we're still requiring, mask up for our staff when entering apartments. Their community mask requirement was lifted on September 9th. Hi, Jaylyn. Jaylyn from Solomon. All of my residents are elderly and have other health issues, so we are not going into apartments unless absolutely necessary. I had 4 residents in the hospital for other reasons during the last 3 weeks. Wow. Gail,
We continue to do our inspections. Employees only enter apartments if asked. Room and meeting rooms use masks and practice social distancing. I have a feeling that's going to become our new norm, as sad as that is for our elderly and our disabled residents. That is becoming our new norm.
It is
How
sad.
and that brings up a question from me. How are you all staying connected with the vulnerable population? I know for us it's different out here because we don't have as many cases as normal, but it's still, when we were quarantining our buildings and not letting anyone from the outside in, you could see the defeat almost on certain tenants' faces. We lost 2 during that time period, one to a nursing home and one to death because, and honestly, I think part of it was broken hearts or just sheer loneliness because their kids couldn't come in, their grandbabies couldn't come in. One lady asked me, because we had Meals on Wheels come to the office and drop off meals, and then my staff and I would drop them off. And the one lady was a little grouchy one day, and she said, "When are other people going to come to my door?" We don't know when other people are coming to your door, but it was a struggle. So how are the rest of you staying connected?
When we were on lockdown and we weren't allowing people in and out of our buildings, we were still holding events with our tenants because we knew that they were in our building, they weren't exposed. We still observe social distancing, but we have a big community room, and we figured since nobody else was coming in, we would get together and we'd have, not everybody would come, but we still had events and, get-togethers, visits.
Good.
And that kind of helped.
Megan says, we partnered with our community mental health service and set up therapy services in the building in 3 separate rooms to ensure people had the supports they needed. Great idea. Great idea.
We also have, we're using some of the CARES money to try to get kind of handhelds in the hands of our seniors who want to be able to use them for Zooming with their family members and grandparents. And we have hired a couple of seniors using that money and providing them stipends. So they do a daily call to other seniors and other vulnerable folks just to say hi, see how they're doing. And that's where we can direct some of the Meals on Wheels and those kinds of things specifically to folks. But we also got the same question about when am I going to get to see somebody else, which hurt the feelings of one of my team members. They're like, no, they're just lonely.
Luckily it was me and I took it in stride, but
Yeah. May I ask, there's so many quiet people. What are some of the conversations you're having in other coffee shops where you can kind of talk comfortable to folk? I'd love to know what else we could be doing on the NARO side to speak to Kansas and help if there's any help that's needed. Maybe no help is needed. I don't know. What are the other conversations happening? It's a quiet group, Sherry.
I know, I can't believe this. First of all, I want to say, and please pass this along, as far as National NARO, you guys have just come out of the woodwork. You have gone above and beyond, just making all the housing authorities feel connected with all the different, it was basically weekly. We were all getting together.
There for a while, it was 2 or 3 times a week, and sometimes a couple a day when all this first started.
It was nice to have that leadership. You just really stepped it up, and was able to get us all through it. Even if we were all out there doing our own little thing, but to hear someone else has done the same thing you did,
Yeah.
it was nice to hear that. So having those, I would like to see us continue in a manner when this is all over. And I don't know when that will be, but having some of those same things continue would be a good thing for our new normal.
Oh, awesome. One of the things that we noticed is that it allowed a lot more folk to participate who might not have been able to if we were flying someplace. And so we did notice we got to, like right now, I might not have been able to have gotten to Kansas specifically, and this way I'm able to be with you. And that is huge, huge for me. And it's been really cool. So we've noticed it on both sides. So you'll notice it in our national conference, which registration just started yesterday. Again, it's going to be virtual, and we're hoping more and more folk can get everybody in a room with social distancing and be there and be present and feel connected. So thank you. I'll share that with Sunny and Adrian. That's great news. Yeah.
And I think since we have not figured out all of it, but since we have all learned so much more about how to electronically communicate and some of this stuff, I am a huge advocate for the small rural housing authority, because that's what I am, and that's why I took this position in Kansas. If there are ways when we can meet again as Southwest or national, where we can have those of us that are there, those of us that can get it on a plane and can fly to National NARO, so be it. But if we can have some sort of a hybrid conference where those small towns, Mark and Lindsborg, or Elma and Ulysses, or even Ty and Liberal, that maybe their housing authorities don't have the budget to get to national, but they could pay a lower registration fee and still be able to do what we are doing today, have some different sessions open for them, some coffee shops like this, be able to watch the main sessions and hear from the people from HUD, like those of us that are in the seats can do.
That's a great idea. Thank you.
Especially, Patricia, if you could even market around somewhat, or small agencies having that break.
Yeah, the small
And
agency,
it's more money.
the small agency committee has been talking a lot about how to just make sure that we're touching everybody and they can touch back, right? Because it's both ways, and being able to talk with us. Thank you. That's actually really good. Anybody else? I see a Rodney, Gail. I know Shelly, Nick, Elma, Patty. I'm gonna call you out just because. And Mandy, I know. So I'm just any other. This is my chance to touch you, and I'm just grateful. But I'm hoping to hear your voice too.
Speak
All
up,
right.
everybody. This is an opportunity to pick her brain.
How'd you guys handle your accounts receivable for rent? How did you keep on top of everybody? Because I'm sure you had to have a huge problem with people deciding not to pay because they could.
Oh, thank you, Rodney. Rodney doesn't have a camera or a microphone, but he's listening. Thank you for letting us know. I was feeling a little hurt.
Rodney is in the county north of me. He has about 20 units in a town about the size of my property. So,
Oh, wow.
he is certainly one of the small agencies that I try to advocate for this kind of conference.
Well, it's nice to meet you, Mr. Ritchie.
I do have a question that I'd like to address regarding the funds, the CARES Act funds. I want to make sure I'm understanding correctly. The operating COVID funds, we can draw down just like our operating subsidy to meet regular payroll, etc. Is that correct?
Yes, that is correct. It comes with, that's a really great question, Judy. It comes with a lot of parameters. Sherry talked about the information that's been coming out from National NARO, where the policy team there has kind of done some Q&As that gives you the guidelines. One of the things that we know is going to happen is that we're all going to get audited on how we use those funds. And so at the front end, really, like our team did a big table that, you know, it's what funding source it is, have operating fund, where we're putting it and why, and then the amount and the date of issuance, so that when HUD comes, we can show that we've been really good stewards of the funds, you know? And so if that's something, Sherry and Shelley, that if it helps, I can send that link so that everyone knows specifically where to go for that guidance, Judy. That way that might help a little bit. Would that be helpful?
Sure, but even so, I'm correct that they can be just to meet regular operating expenses for the operating fund. Now, the CFP CARES Act money is more specific. So if we had people that truly had to quarantine or be isolated, that we could keep track of what their pay was for that period, keep track of PPE equipment that we had to purchase, sneeze guards, and I've created a spreadsheet listing those, and then to draw down the CFP money for those specific items. But however, I'm using the operating CARES Act money just for regular operating expenses.
Yeah, we're doing the same thing.
Yeah, Judy, you can do that. Just make sure that you keep your backup documentation. That's the key. Backup documentation as to what you spent those funds even on.
Even the operating funds.
Yes, yes.
We're doing
Even
it
though-
we're doing it, Judy, as a safe practice, because just like we're trying to figure it out, so are our partners at HUD. And so just to make it easy on everybody, we're treating it all with the same kind of careful tracking. So yes, that would be my encouragement.
Okay. Thank you.
Megan has a comment on the chat that says, we did have plenty of people who decided to take a rent vacation, and it's been interesting trying to get back into collecting on a regular basis. We sent out a letter and repayment agreement at the end of July, with the repayment agreements due back into the office at the end of August. The tenants have the option of paying up front by the end of September, or paying $50 a month or more beginning in October. Any tenant who didn't return their agreement is expected to pay back by the end of September. It's going to be interesting to see if people fulfill their agreements or what they're going to do going forward. It is interesting. I have 4 who perpetually pay late every month anyway, and so now they're dragging it out even farther. I haven't given them a lot of options to not pay. My staff and I just kept, and unfortunately, these people are taking advantage of the way the system is working right now through COVID, because not one of the 4 had any kind of an excuse for not paying their rent. 2 of them kept their jobs and the other 2 didn't have one to begin with. So yeah, they were just taking advantage of the situation.
We called them every day. They didn't pay.
We called them twice a week, Monday and Friday. Monday and Friday. Matter of fact, we called them this morning.
Have you had any requests from tenants that are different than the usual kinds of requests, in addition to just kind of what's going on with their rent payment, but different kind of help? I realize that it must feel a little bit different depending upon what county you're in there in Kansas. Here on the West Coast, there's still a lot of fear because of this year, just the sheer numbers of folks that have been stricken by the disease and the fact that businesses have shut down. So we've got a lot of tenants coming through asking for help that wouldn't normally be a housing authority kind of help. I noticed somebody talked about mental health services, so we've given a lot of partners access to come to our clients. Is there anything like that going on, or because your numbers aren't as high, is it more comfortable for everyone? And that's a question.
Well, I can say, Patricia, believe it or not, we're getting interest from the metropolitan areas to come to the rural areas because they feel to be safer,
Safer.
not as many people.
Mm-hmm.
Yeah. So I think that's a great time for a small housing authority to maybe beef up their marketing. If they can get them to move to a small community, I think that's great.
Mm-hmm. Yeah.
I will say I have had more applications in the last through the summer than we normally see out here in Goodland. And some of them were leaving Denver or leaving the foothills of Colorado and wanting to get away from the worst of it. Very few of them followed through. I don't know if they changed their mind when they got here, or if they changed their mind, it was too much paperwork, or if they just decided to stay in the city. I don't know, but we saw very few of them. We had a lot of people call and get applications, but we saw very few of them. We saw more people who were struggling. You asked about unusual requests. Our city bus service shut down. And so we have a lot of seniors who don't drive. They needed prescriptions picked up. They needed food from the grocery store. And we have Walmart as our only grocery store for miles around. So requesting that kind of help. Our sheriff in our county stepped up and did all drug deliveries that anybody needed. All you had to do was call the sheriff's department, which I felt much more comfortable with him picking up their drugs and delivering them than myself or my staff. I just didn't want to put anybody in that situation. But my staff and I did go to Walmart and did grocery shopping for those that either were compromised health-wise or just couldn't get a ride out there. They don't have any family. They don't have anybody to drive them. They didn't want to go. That was probably the most unusual request we had.
Yeah. Yeah. That's a wonderful action on the part of the sheriff.
Oh, yeah. Oh, yeah. It was an
Awesome. Yeah.
He was here daily and bringing medications to people. So it was awesome.
We don't hear those stories. We need to hear those kinds of stories in addition to the other stories in the news about our law enforcement heroes. Yeah. Wow. Wow.
The state of Kansas gave them additional funding to assist the community, which was pretty cool. So yeah, it was kind of a thing in Kansas to have the sheriff's department out picking up groceries, picking up drugs.
One of we have a police department here at the Housing Authority, and our officers went to a couple of sites last Friday because all of our schools are closed and distance learning, and delivered lunches to the kids. And the city school system was giving away the laptops, so we did both. We delivered lunches and just made sure every child had an ability to learn from home. And so it's again a story that didn't make the news, but we advertised it here, and it just warms your heart to be able to see that.
Our school system and our Salvation Army, which is Genesis, once the kids were out of school after spring break, everybody was scrambling. especially our lower income families. How are we going to feed those kids all day long? So they were delivering outside meals to any student, anyone under the age of 18. You had to have an adult with you, but you could go to the high school and they were giving out lunches and breakfasts for the next day. And they continued that. Normally we have our summer lunch program. There's 5 different, the library does it twice a week. Our office does it once a week. Sheriff's Department does it once a week. And the senior center, the kids can go there and get a free sack lunch all week long. Well, because of COVID and because of the other issues, the school just went ahead and used their supplies and fed the kids all summer long, which was huge for those families that they're not in school anymore. They're not going to daycare, or they're at home. And it's that mealtime became a struggle for a lot of them.
Wow.
We work very closely. I'm on the board of our Salvation Army here. Our Walmart donates all the food that they pull off the shelf on their pull-by date, and they donate it to Genesis. It goes to 5 different agencies throughout the month. In the last month, the board chair was gone for a couple of Fridays, so I took the responsibility of picking up the food, and she said, "You're picking it up, take it to the towers." We had one day, I told a group earlier, one day we had 72 racks of barbecue ribs. Everybody got barbecue ribs and chickens, whole chickens, and fruits and vegetables, eggs, milk. We had food from the Senior Farmers Nutrition Program. So we had fresh fruits and vegetables for everybody, not just the seniors, not just the disabled, but the families as well. So that's been a big thing for me. I don't want to see anyone hungry, especially the kiddos, and especially our seniors that can't afford. Sometimes they have to make that decision between groceries and meds. So we've worked hard on that.
So I can tell, but so Elma just weighed in that she talked about a college-age daughter who got sent home, and they made some adjustments to her living with her mama. And Mark shared that you guys have been blessed, it sounds like, not to have much of an impact. So I realized that kind of my experience is dramatically different. So then that makes me wonder, what are the things that are important? If we just take COVID and what's happening out the picture, what are the things that are important to Kansas, and things that you're talking about since it hasn't impacted as much as it's impacted other parts of our country?
Have you enjoyed, or do you think needs to happen more of HUD training? I know HUD's been doing a lot of training on basically any that comes out. They're giving that. Are you taking advantage? Do you like it, or do you hate it? Don't everybody talk at once.
I think this new format has everybody a mess, including us. I think we've all learned to do everything differently. COVID aside, we still need the training. We still need the HUD contact. We still need the NARO contact. We still need, sometimes even those of us that have done this for years, right, Sherry? We still need some guidance here and there on stuff.
Oh, yeah. Absolutely. I've enjoyed, like I say, I've enjoyed the NARO stuff. I've enjoyed HUD. Taking that extra time to just, you read it, it's nice to hear it. So I would really like to see them continue that, because obviously they can do that. They've shown they can.
It's amazing what we've been able to do in the midst of a crisis of things that we could have been doing for a long time, isn't it? It's like the bar has been raised.
Oh even like the telecommuting. If you'd have asked me on March 1st, can you telecommute? No, absolutely not. I have to be in the office. That's it. Oh, I guess I can. And I want everybody to think about that. Even if there is just 2 people in your office, someone comes down with it, or you've been exposed and you have to quarantine. How are you going to keep that agency moving? Do you have the equipment that you can take home? Do you have a policy that allows you to take it home? In order to work, can you communicate to your file server? I mean, what have you done, or have you even thought about that? I really would want to hear some people what they're going to do. Ty.
Well, we at my agency, when I took over, the first thing that the previous director had purchased for my replacement was, or bringing in anyway, was a laptop. And so I can take that home, and we have a remote desktop application on my computer here. So I can dial into my desktop, and, it appears on my laptop, and I can do everything that I need to do remotely if I have to.
That's key, because your agency has to keep running.
Yeah. Yeah, the hardest part is if I'm not here, printing of checks, because the checks print out here, and but one piece of our software is I can electronically sign my checks, and then if I'm being the one quarantining, and then I have a resident board member, so she could come in and get the checks and finish the signature and drop them off so I can mail them.
Glad that you thought that through.
Let's see, Mark says we created a work from home emergency policy almost immediately. Our biggest concern would be if both office employees became so sick that they could not deal with the day-to-day needs of the operation. We have purchased software for remote operations. Let's see, Megan says, I've got a work laptop as well as a personal laptop, so if I need to work from home without planning, I can answer emails and calls from home. And if I can plan it, I have a remote desktop as well that allows me to do whatever I need to from home.
Good.
Since I had a computer crash in the middle of COVID, one of our computers crashed, and I'm getting a new system next week. It will have remote software on it. And I went and bought a Chromebook, so I can still do a lot of stuff. It's not quite as efficient as having a big laptop, but it's certainly easier to get around with. And then I have a laptop at home as well. And I have trained my maintenance staff. They can't do everything in the office, but they know to check the phone. They can answer the phones. They can take rents. They can do some of the simple stuff in the office that needs to be done on a day-to-day basis. We've all learned to wear a lot of different hats in the middle of all of this as well.
When it first started, I actually worked with one of the team members and tried to sew handmade face coverings. So I learned I'm not good at sewing, but I also learned how to make a mask. And so we gave those out to staff and to some of our seniors. So we did similar jack of all trades kind of activities.
Okay, ladies, gentlemen, we have about 5 minutes and we'll need to start wrapping up. Is there anything else that is at the top of anybody's list or on their mind that we really need to talk about today? Anything else we need to pull out of Patricia's tool chest?
We have a question from Gail. She's wondering if anybody limited visitors into the facilities, and if so, how many at a time per tenant?
We limited for a while, Gail. We just shut everything. There were no visitors other than I have a few people that have live-in or caregivers. We did not limit caregivers coming in, but as far as family and just somebody coming to bring you flowers for the day, we limited all of that for a while. And we've opened it back up and have no limitations at this time.
We aren't open yet. We're coming into the offices, but our community spaces aren't open.
We've closed the community spaces until the first of the year, which will probably be extended as well.
Yeah.
And our office is limited as far as when we're open to the public. That allows cleaning and those type of things. But anybody can call and request an appointment with us at any time. I know probably a lot of housing authorities put in drop boxes to accept applications and stuff like that. We're redoing our website so that we can take applications online and communicate with our current residents. You know, we've had a website, we just really didn't utilize it, and we didn't ever update it. It's probably been over 20 years since it's been updated, so you can imagine how bad it was.
We had drop boxes before for those that wanted to drop rents off after hours or whatever, but we put up baskets with envelopes and provided envelopes and pencils for them to write on. Yep, totally lost my other train of thought.
I've been doing that a lot during COVID.
I have done that a lot during COVID too.
So we added a drop box outside as well. And since we're in a building that we lease space out because we're a cap agency, we couldn't really shut the building down, but we do require the masks. Into our specific office, we kind of limited to appointment only for a while, but we're back up to letting folks in as long as they have the masks on and they're comfortable with it.
We've been getting a lot of emails and stuff from developers and stuff on RAD.
Yes, every day.
Okay. How you handling that, or what's your thought on it?
Delete button. Just like Mark did, you just see Mark and hit the delete button.
Yeah.
How did you all handle for rent payments? I have several that a lot of our tenants still pay cash. I tried to get our board to change that policy, but our resident board member happens to be one of those that pays cash. And she said, no. So then I had a lot of people, especially during COVID, call in with their debit card number. And we don't have that ability here to take a debit card. I've looked into a couple of companies, but they charge a transaction fee. I don't want to charge the tenants that. I don't have it in my budget to pay it myself. So how do you all handle that?
Have you thought about Venmo?
Thought about what?
Venmo?
No.
It's free.
Writing it down. I'm
Right
calling
price.
you in a few days to get information. Okay.
Can you email us information?
When I get it from Sherry, I will.
Okay.
Hey, Abby just kicked us out. So I'm going to guess our session is over. Here is your game code.
I didn't kick you out. I just wanted to make sure everybody got the game code if you're participating. You've got some really great prizes, so be sure you're writing down all the codes and putting them in the app so you can be collecting points.
Tricia, thank you so much for joining us. It was wonderful to talk to you and to see your face since we haven't been able to get together. Sherry, thank you for all your information as well.
Thank you for inviting me. This really meant a lot, and I appreciate, I just appreciate being actually in Kansas today. I get to say I was in Kansas.
There you go.
I've only been there once before, so this is pretty cool. So thank you all. And please just keep your spirits up. The work that you're doing out there is tremendous. And the fact that you're so dedicated to it, that's what Heart is all about. So thank you.
All right. I will see you all at the next meeting.
Yep.
Bye.